Hello, it's Dr. Earle again. I'm here to talk about another type of depression. Now, the last time we talked about major depressive disorder. This time we're going to talk about persistent depressive disorder, also known as dysthymic disorder. Now, before I do that, I just want to give you a little introduction about where we are. I'm in my house. This is where I live, and I'm doing this video in my dining room, and behind me over there is my living room, and what you see in red is my hallway. So anyway, I'm right here in my house. Okay, dysthymic disorder. Dysthymic disorder is the type of depression that is like an underlying feeling of sadness. It continues over the course of at least 2 years. A person with dysthymic disorder, may have occasional exacerbation of depressive symptoms similar to what you would find in major depression, but it's not as intense, but it does cause a disruption in their daily activities. This depressed mood is not as intense as major depressive disorder. Dysthymic disorder generally occurs for most of the day, more days than not, for at least 2 years continuously. A person with dysthymic disorder will describe their mood as sad or down in the dumps. But just like I said for major depressive disorder, the expression of this disorder in children is different than you would find in adults. In other words, a child or teenager that has dysthymic disorder will present as being very irritable and difficult to get along with. All right, now, for adults and for children, they have to have at least 2 of the following symptoms in order to be diagnosed with dysthymic disorder, such as poor appetite or overeating, insomnia, low energy, low self-esteem, poor concentration, difficulty making decisions, helplessness, hopelessness, low interest, self-criticism, and seeing yourself as being uninteresting or incapable. Because these symptoms have become so much a part of their life, their day-to-day life, it's like they feel like they've always been this way. The dysthymic disorder can only be diagnosed, if it is free of major depressive disorder, which would change it, the diagnosis if they came out with more serious symptoms. You will notice that in the symptoms that I have outlined for you, there is no self-destruction. There is no suicidal or homicidal ideation. All right? That's what makes dysthymia not quite as destructive as major depressive disorder. However, the symptoms must cause clinically significant distress or impairment in social, occupational, academic, or some other very important area of functioning. Okay? And that would be what dysthymic disorder is about. Next week, we'll talk about another depressive disorder. Let me see, I think we'll talk about postpartum depression, usually found in women after they've had a baby. At any rate, I'll see you next week. Take care. Stay tuned. Bye now.